Hello, guys. Welcome to a very interesting webinar, a comprehensive explanation of type 2 diabetes reversal program. So, how we can reverse type 2 diabetes naturally without any medication. So, today we're going to understand first the root causes of such a modern epidemic. We are seeing it as an epidemic. Just in the span of last one generation, it has increased to almost fourfold globally. So today, such an important topic. We're going to discuss everything in detail. With me, I have my colleagues, Mr. Kaushal Tai. He will be talking about the mental health and type 2 diabetes. Then I have with my another colleague, Dr. Namrata. She'll talk about hypertension, how to reverse hypertension naturally. So this is very interesting webinar. I think you should get hooked to this and be with us for at least 1 hour. And in this 30 minutes, I'll be talking about type 2 insights on type 2 diabetes. Dr. Namrata will talk about hypertension for 15 minutes, and Mr. Kaushal Tai will talk about mental health and the connection of diabetes and metabolic issues. So let's begin now. To start with, let's first understand what is type 2 diabetes. So type 2 diabetes is a metabolic condition. Type 2 diabetes is a metabolic disorder characterized by high blood glucose. So if you want to understand the root cause of type 2 diabetes, just simple one thing. I think that will make us really understand what is the basics, why we actually develop type 2 diabetes, why we develop these metabolic issues. It is simple. Two things you have to remember. One is high carbs. When you're eating food, too much of carbs in the food, causing high insulin in the body. High carbs and high insulin. So that means that whenever eating carbs, insulin is getting released. So the problem, the basic root problem is too much of carbs and too much of insulin. So now the solution is simple, isn't it? If you understand the root cause, that there's too much of carbohydrates in our food, and there's because of too much of ingestion of carbohydrates, there is a triggering to the pancreas, and the pancreas triggers and they release insulin. Why? Because insulin plays a very important role. It shifts the glucose from the blood into the tissues, into the cells. Simple. That's its work. But too much of that is needed whenever there's too much of blood sugars is found in the blood. So whenever there's too much of carbs we are finding, too much of sugar we are finding in the blood, you will see too much of insulin getting released. Understand? So there is a direct proportional between the amount of carbs you ingest and amount of insulin the pancreas is releasing, right? And that's what is happening in type 2 diabetes. The pancreas got exhausted. They're not dead. Pancreatic cells are not dead. What doctors think, they're dead. In type 1 diabetes, we understand. It happens. So next slide, if you see that, next slide. How type 2 diabetes became a global epidemic. So how it has become a global epidemic, we need to understand just in a single generation, the number of people worldwide suffering with diabetes has actually quadrupled, isn't it? That means a rare disease, which was very rare in 1970s and 80s, a very rare disease, has become the epidemic of 21st century. So this is an alarming situation for type 2 diabetes, isn't it? So the dramatic coincides. What it drives is directly shifts in the dietary. So why it happened? Why we are seeing too much of cases around the world? Because of two reasons. One is the dietary recommendations of 1977 by the American Diabetic Association. That's one of the reasons why we are seeing global rise in diabetes after 1980s, after their dietary guidelines. And then second is because of the food production practices. What is happening? Because of GMO food. Because what happened? The structure of the food is being altered. We thinking we are actually advancing by genetic engineering and all that. But actually, especially in food industry, we have actually destroyed the protein and the starch of the food. And because of that, when we're eating this new food, the genetically modified food, what is happening? It is converting into sugar very quickly. So there are two major reasons, remember that. One is a wrong dietary recommendation, thanks to American Diabetic Association of 1977. The second is the production, that is the food production practices, is one of the reasons why we are seeing a global epidemic, global rise of type 2 diabetes in a span of just hardly 1 or 2 generations, right? So this is what it talks about. Now, in 1980, what happened? What was the dietary guidelines? We need to understand that the dietary guideline what they gave in 1980 by American Diabetic Association was they were pushing for high carbs. They said you can have more of carbs. So that means they said it was before. It was like people were having less of carbs before 1977. People were having good quality of fat before. But what happened in 1977, 1980 guidelines? They have pushed carbs, and they said, and what they did, the pyramid, the base of the pyramid, if you see the food pyramid, the base of the pyramid, what they said, you can have a lot of breads, pastas, and potatoes. This is what they said, which is not a good guidelines. But on the basis of that, what happened? The whole industry shifted. Whole industry, the caterers, the food industry, they shifted the whole focus from healthy fats to breads, pastas, and potatoes. That's why you see chips, and you see so much of abundance of chips in every takeaways. Thanks to American Diabetic Association. That's the guidelines we all followed, and today, unfortunately, we are the grip of the epidemic of type 2 diabetes. The other thing what they did is they have put a low-fat mandate. Everywhere you're seeing low-fat milk, low-fat consumption. So what they did, they have reduced the fat consumption, which was very good those days, and they reduced it approximately from 40% of the calories down to just 30% of the calories. So they reduced the good quality of fats as per the recommendation, and they added a lot of carbs in the recommendation. When this recommendation people started following, industry started following, we started seeing rise in fatty livers, rise in non-alcoholic fatty livers. Why fatty liver? People saying that fatty liver. Before 1977-88, fatty livers were people only having alcohol. Now, because too much of carbs. Too much of carbs is simple. It's just too much of carbs, and two reasons. One is the wrong production, and the other is the wrong dietary guidelines. That's we have to remember why we are seeing this grip. The second is what happened after the 1980 dietary guidelines. Suddenly there was a immediate obesity response was there. So globally, people started following this diet, and a lot of food outlets started offering these kind of food to the people in the communities. What happened? There's an unprecedented climb of the cases of type 2 diabetes globally, and issues of metabolic issues. The people started developing metabolic issues. People started developing hypertension. People started developing a lot of lipids, right? And women started seeing PCOS. So this is all thanks to that American Diabetic Association and the genetically modified organism food, which was which we have seen in our times in 1980s and 90s. If you see people who are from 90s, 80s, and 90s, they have seen the invention of hybrid seeds and hybrid seed and hybrid seeds. So these hybrid seeds, what are the hybrid seeds? What they did? They did great job. Scientists did great job at one side by taking care of the production and all that. From before, for example, in 1 acre of the land, there was 1 ton of wheat used to be yield. Now, after the GMO food, what happened? They were yielding nearly almost 10 times more. We got a lot of production. Food become abundance. But what happened? The quality of food has decreased. And because of that, we are seeing the global rise of diabetes. If you take the next slide. So you see the number of figures there. From 108 million to 422 million just in a span of 1 decade. Okay, so this is unstoppable trajectory. If you see this one, the concerning fact is that it seems to be there's no end to this. There is no end to this. We are seeing it rise every year. We are seeing it increasing in numbers, increasing. So now by 2045, they're projecting. Next slide. By 2045, they're projecting. And they're predicting that it will cross at least 700 million people will be suffering with type 2 diabetes across the globe. So this is what the prediction is. And that is very alarming. And this burden of diabetes extends beyond individual health, to be very frank. It is affecting economics, productivity, healthcare system, and there's become a big, huge load on burden on the healthcare system. Just this one. And today, We have lost NHS, unfortunately, in US. Why? Because too much of burden of the ultimate bill of medications. Too much. Because for this disease, all you required is to just change your lifestyle, change your metabolic, change your lifestyle, change your habit. That's all you need to do. I will see that how easy it is to reverse type 2 diabetes. It is really one of the easiest things to do that. All you need to do is just give them a proper information to the people who are coming to the clinics, proper information to people who are actually taking these treatments for the doctors. So what happened? That this disease doesn't discriminate. This disease, if you see, it doesn't discriminate any kind of geographics. It doesn't discriminate, a developing nation or developed nations. So it is equally affecting all the nations, and it is a global problem, right? So if you see the other slides, so what about the 20? Now, what happened is after this, and recently, in 2016, people like us, we started questioning them, dietary guidelines. A lot of doctors around the world started asking these questions. What happened in dietary guidelines? Why this wrong dietary guidelines is being given? So what happened? In 2016, they took a U-turn. What they did? They removed the fat restrictions were removed. Before, fat were restricted were there. Now they removed the restrictions on the total dietary fat. And what happened? And healthy fats were recognized. Before, they said, next slide, please. If you see that slide, if you see healthy fats were recognized. Before, they said egg, the yolk of the egg is a villain. They said it's a villain. They said avocado is a villain. They said nuts and olive oil. They said they're all villain. But now, after 2016 dietary guidelines, they've reversed this whole thing. And they say you can have this thing and given this a green signal to these kind of foods. Before, they've said, good food. These are good food, like avocado, nuts, and olive. And they blamed it. They made the villains in 1970s. They said they are the villains. And we stop it. And ghee, they said ghee, which is clarified butter. They said it's villain. No, it's not at all. You're going to see that. We're getting amazing results with this thing. But they have changed it. But at 2016, they changed it, So now what is the traditional treatment approaches? We all know that somebody has type 1 diabetes. We understand it is insulin dependent. So we need to give insulin. Definitely. No doubt about that. And it is autoimmune disorder. And it is an autoimmune disorder. So what it means autoimmune disorder means your own cells are attacking your own cells. The cells are attacking, the immune cells are attacking your own cells in the organs. Like, for example, autoimmune disease, how it starts? It all starts from the gut. It all starts from the gut. What happens? When when we're eating this food, our body is taking this as a foreign foreign object, and what is happening is creating antibodies against that. Then these antigen antibodies, complexes, they are creating inflammation. They're creating leaky guts. When they pass through the leaky gut and goes and sit in the joints, you'll get arthritis. Go in the thyroid, you get Hashimoto-thyroiditis, right? And what happens? Go and sit on the pancreas and attack pancreatic cells. You get type 1 diabetes. And type 1 diabetes is also reversible if we catch hold of that disease in the early phase of the attack. So even type 1 is reversible. So they don't have to lose any hope in any of the diseases. Okay. Now type 2 diabetes is definitely because of what? It is because of metabolic issues. It is because of lifestyle disorder. But what is the current treatment approach? They're focusing on reducing the blood sugar. What is blood sugar? Blood sugar is nothing but is a symptom. Blood sugar is nothing but a symptom. But too much of focus has been given, too much attention has been given to blood sugar. So there are two things happening in the body when somebody is having diabetes. They're having two toxicities. One is insulin toxicity, the other is sugar toxicity, that is called glucotoxicity. So if you see the type, what is the symptoms? If you see symptoms of type 2 diabetes, simple. Too much of pain is there. Feeling thirsty most of the times, right? Then feeling very tired, lack of energy, losing weight, right? Then you have this itching around your regions, your genital areas, and eating more than usual, and feeling too much of eating, too much of peeing, right? These are all the symptoms of type 2 diabetes. Okay, so and you see a lot of things will happen when you get developed diabetes, like you don't heal properly, the cuts and wounds, you don't heal properly, and you develop even as Alzheimer's. Now they have said that you develop Alzheimer's, dementia symptoms, and symptoms of dementia, and then you have the blurred vision at the same time, right? So this is what you're going to develop when you develop type 2 diabetes. So So key to reversing type 2 diabetes. The next slide. The key to reversing type 2 diabetes is to managing, not to manage the symptoms, but to focus on the root cause. How are we going to focus on the root cause? We need to understand what is the root cause. The root cause is what? That is insulin resistance, isn't it? So you take the next slide, please. Insulin resistance. So insulin resistance is the root cause of type 2 diabetes. How we develop insulin resistance? How we develop insulin resistance is because of too much of insulin getting released, because every time eating carbs, body is, to compensate that, body is releasing insulin. So too much of insulin, what is happening? So this is the problem you're seeing that here. If you see that, what is the main problem here? It is the insulin resistance you develop. Why? How you develop the insulin resistance? That is the insulin receptors which are there on every muscle and every tissue is being affected. So that's the key pathway. It is affected. The second thing is reduce glucose uptake. When these receptors are affected, the glucose is not getting ingested properly. So the reduced glucose uptake is there. That means the skeletal muscles are not getting glucose, and there's a problem with the metabolism of the glucose, metabolism of the insulin. So what is happening because of this thing? Progressive beta cell dysfunction is happening. That is because of chronic overstimulation, because insulin has been, pancreas is releasing insulin so much that because of too much of insulin getting released, too much of overstimulation of the pancreas got tired. They just got tired. They're not dead. They're just tired. Okay. So now what is that? Understanding the insulin resistance development, right? So what is happening? Insulin role in the body is simple. Number one, the next slide, please. The number one is insulin's role in the body. Insulin is a hormone released by the pancreas to regulate blood sugar levels. That's number one. Second is chronic overstimulation. Chronic overstimulation, constant release due to frequent eating and overconsumption. You get releasing too much of overstimulation is happening. Of what? Of insulin. So we are releasing too much of insulin. Third is linked to obesity and metabolic syndrome. The third one is what is happening because understanding the connection in insulin resistance, obesity, and a development of metabolic syndrome. What is metabolic syndrome? Metabolic syndrome is a cluster of various diseases. When somebody gets diabetes, they just don't get diabetes per se alone. They will get associated diseases like cholesterol also. They will get cholesterol also, or they get hypertension also. With Dr. Namrata, I'm going to talk about hypertension now in a bit. So people are developing not only one disease, they develop. It's a cluster. It's a cluster of metabolic disease. So some people will develop either a standalone diabetes. Some people will develop just hypertension. Some cholesterol. Some get in one or two together. So that's what we have to do. Basically, what is needed is people should be educated. People should know that this is part of a bigger picture. And that metabolic syndrome is because of too much of release of insulin. That's it. That what is happening in the body? Two toxicities is happening. If you go to the next slide, if you see this next slide, so what is happening? The cluster of risk factors, you will see that. What is the risk factors? And whenever you have this, one of these, what is happening in metabolic syndrome? I'll tell you that. Right? What is happening? You develop hypertension, you develop obesity, you get high TG, high triglycerides, and low HDLs and insulin. Because of this, all we are developing all these metabolic syndrome. These are part of metabolic syndrome. What is, again I repeat, type 1 diabetes, hypertension, lipids, right? Then you have PCOS, then high triglycerides and obesity. This is part of all metabolic syndrome. Why are we developing them? Because of insulin resistance. And what happens? Because of these diseases, this cluster of metabolic issues, a lot of risk factors can happen. It increases risk factors of modern metabolic diseases, like for example heart attacks can come, right? Because why? Because you're having this one or two part of the metabolic syndrome, and this is all because of one issue only, that is metabolic syndrome. And if you focus, what is happening at our platforms, people are coming for type 2 diabetes reversal program, right? And what happens at the same time, if the blood pressure, if linked to metabolic syndrome, that also blood pressure is also going off. The blood pressure coming off. The cholesterols are coming off. So this is what we are doing here. Hi, Manruchi, you're there. Thank you for joining us for the show. Thank you for coming us. Yeah, you have any questions, we'll give you the time at the end. We can have some discussion on the questions and answers at the same time. So what is happening is, it is not coming per se alone. It is always comes with either diabetes. Even diabetes will always come with cholesterol or hypertension, right? Or other metabolic syndromes as well, like PCOS and all that. So this is never gonna come alone. It always comes together, and because the reason for that is because it is not a disease as such alone. Type 2 diabetes is not a disease, it is a symptom. It is a symptom of a metabolic syndrome. High blood pressure is a symptom of a metabolic syndrome, right? High cholesterol is a symptom of a metabolic syndrome. So people have to understand this. If you understand the root cause, the simple root cause is simple. What is root cause? Too much of carbs, too much of insulin getting released. If we understand this phenomena, we can easily reverse this condition. We easily reverse. The main problem is too much of insulin getting released, and because of that, pancreas got tired. वो बोले कि थक गए हैं, अभी हम थक गए हैं, अभी हम कुछ insulin पैदा नहीं कर सकते. That's what we are doing is we regenerating that on our platform. How we are doing that? By our food, by intermittent fasting. I'm going to show you how we're going to do that now. So now if you see that, what is the main two things happening in the body? People are suffering a metabolic issue, glucotoxicity and insulin toxicity. Two things. What is insulin toxicity? Because we're eating too much of carbs. Because of that, insulin is getting released. And this insulin toxicity happened for 10 years. Then after that, you see glucose coming out in the body. That's again a symptom, isn't it? So for 10 years, your insulin was releasing, like, compensating release. Too much of overstimulation was there because every time eating carb, insulin was released. And because of insulin, so much things happen in your body. What happened? It promotes inflammation. When it promotes inflammation, what it does, inflammation, it creates cellular dysfunction. And what happens to that? People develop weight gain. Too much of insulin, what happens? People develop weight gain, and problem of heart, cardiovascular disease, and other cancer risk also is part of this. Even risk of cancer is part of that. Okay, of what? Of insulin toxicity. Nobody talks about that. Nobody talks. You go to the doctor, they never talk about what happened 10 years before your diabetes, you developing diabetes. They never talk. They don't discuss at all. They say, oh, sugar is high, sugar is high. They just focus on sugar. Sugar, that is a symptom. If you are having fever and you go to a doctor, what you're supposed to get from the doctor? Two things. One is the antibiotic. One is antipyretics. That is high fever. For high fever, they should give, and they should give for infection. What is the root cause also they should give? If they're just giving you for just paracetamol, if they're just focusing on a symptom, that is a fever, what happens? You keep on going to the doctor, keep on going to the doctor. This is what's happening. This high blood sugar is a symptom. Root problem is insulin resistance. Too much of insulin got released. Overstimulation of pancreas happened. And because of that, pancreas are tired. They're not dead. Unlike type 1 diabetes. Okay, so the reversal paradigm shift. So what we are doing here is, what is traditional approach? Doctors, what they do? They focus on the symptoms. They just focus on the symptom. You got diabetes, okay, take this metformin. You got hypertension, okay, take this one, hypertension tablet. You got lipids, take this for atorvastatin tablet for that. PCOS, okay, take this hormonal tablets. Obesity, now they got injection, Monjoros and all that. Nobody's talking about the root cause. Nobody's talking about the what is the main problem. That is hyperinsulinemia. So at our place, what we are doing is we're trying to change the shift from people management of the disease to the cure and to the healing. Enough of management. Enough of becoming the agents of the pharmaceutical company, big pharma. We have simply become the agents of big pharma. The other day, I was talking to a doctor. I met one of the doctors just 2 days back. And a doctor was telling what to do. I said, why are you killing patients, man, by giving these medications? They're type 2 diabetes. Enough. Big pharma has got what they got. Enough now. Come on, stop killing patients. He said, no, what to do? Patients don't change their habits. But have you told the patient that this possibility is there? They have taken an informed decision that that's not happening. That's not happening. When you go to a doctor is not telling you, but he's presuming it, that he will not change the lifestyle. Come on. But this is not the way to do that, isn't it? They should tell you the information, give the correct information, tell you that, see, lifestyle and habits can change, can reverse this condition, right? And other thing is, this medication which I'm giving, this is all symptomatic. They should say this thing, and this is not happening. So that's what we are trying to do now. This is what we are trying to promote through our platform, that you have to start practicing. Doctors who are watching this, we have to tell them, you have to give them the complete information so that they take informed decisions. And what at our platform we're seeing amazing results. Day in, day out, we have amazing results coming in. Like we have people who have been hooked to medication for nearly 25, 30 years. They started with one medication, 2, 3. If this is working, why they're adding medications? Tell me that. If this philosophy of managing the symptom is working, why they're adding the medications every now and then? Metformin, gliclazide, and keep on adding that. Then at the end, they put insulin. The problem is actually too much of insulin got released, and at the end, they're putting insulin on you. Such a horrible thing to do. Such a worst thing to do to a person. Somebody's having the type 2 diabetes. Type 1, I understand. Insulin is needed, not for type 2. Okay, that's what. The reversal paradigm takes a fundamentally different approach. What we do, reversal paradigm, we reduce the dietary stimulus that drives high insulin and blood sugar in the first place. So I'm going to take you to quickly what are the things what we offer from our platform. People are suffering with diabetes. We offer intermittent fasting. That's one of the good things to do. Intermittent, why? It involves cycling between the periods of eating and voluntary fasting. What is happening with this thing? What is happening with fasting? You are keeping the insulin at the minimalist level with fasting, right? And when you're fasting, your fat, which is there, which has already been stored, is utilized and converted into glucose. So you're not getting this from the diet, but directly which is stores, which is glycogen, which is stored, which is storage of glucose in a liver called glycogen, right? That is getting utilized, right? Then the fat which is there when you do repeated fasting, the fat which is there, that is converted into glucose, right? And that's what it is utilizing. So yes, too much of storage there, plenty of storage is there. We have to utilize the storage. When you utilize the storage, insulin sensitivity improves. When you reduce the fat, when you reduce the weight, the sensitivity of insulin improves, and you reduce the symptoms of metabolic syndrome. That's simple. So intermittent fasting is the best thing to happen to the mankind. And we have been doing this fasting. All religious people, we have been fasting since like thousands of years. We have been fasting, right? Why? Because it's good for our health. It's good for us. It's good for our body. It promotes weight loss and fat burning, reduces inflammation. It reduces. Fasting is not supposed to say it is one of the miracles of God if you're doing that on a regular basis. People should get hooked to that fasting. So when somebody coming to a platform, we put them on fasting. We put them on Mondays and Thursday fast. We give them on fasting. We put them on intermittent fasting. We give basically daily fasting. We usually put, depending on patient to patient, we alter that fasting protocols. That's when we do that. Second thing, what we are focusing on is low carb and good quality of fat. If you see a lot of people, I've seen a lot of dietitians coming to my platform also. They're just used to writing low fat milk, low fat dairy. But that's another thing. Low fat dairy. Why it requires good fat? Good fat. When you eat good fat, what happens? Your good fat will go and create a satiety. It gives the feeling of fullness. If fat is less, what happened in 1970-80 guidelines, which I told you, which American Diabetic Association has given the guidelines? What happened that time? What happened? They reduced the quality of fat from 40% to 30%. Natural fat. What happened? When carbs reduce in our diet, when fat reduce, good quality fat is reduced in the diet, you eat too much of carbs as a compensation, because we need to feel full, isn't it? So what is happening? What we do, we reverse that. We reduce the carb, because carbs is triggering insulin. We don't want insulin to be triggered in your body, because we want to reverse your metabolic syndrome, isn't it? So we don't want insulin to get triggered. So we give very low carbs and very good quality of fat, like avocado. So there's a feast on our platform. People who come on our platform, they think, people once who come to our platform, they like our food and they want our food. Why? Because we have not deprived them of anything. We include them with a lot of different kind of food, like different colors, like vegetables, good quality food, that they're going to get empowered at our platform. When somebody coming to our platform, it's just not like that. You get empowered at our platform. Okay. So I think I'll just take another 2-3 minutes, then I can hand over to Dr. Amata. So we have the ketogenic diet is there, fasting mimicking diets are there. We have beautiful diets. All these diets, what we are offering from our platform is evidence-based diets. The clinical trials have been done on them, and we're closely following universities like Harvard University, and we have different departments and they're running this gastric projects now microbiome projects on the gut and all that. So we're closely following all these big universities around the world. So we are offering the platform, the evidence-based food to you people, and at the same time we clubbed a bit of Ayurveda, a bit of prophetic medicine, and that's what we are offering from us, and we're getting wonderful results at our platform. So anybody who's looking to reverse type 2 diabetes, the medication is not the answer. That's what I'm to say. Medication is not the answer. The answer lies in your diet? The answer lies in your kitchen. Answer lies in your table, what you're eating, right? So this is what, if you have any questions, we'll at the end of this session, we'll take the question and answers also from you, and we could learn so many things, from each other. This is what the platform is all about, giving ethical and honest opinions from a platform, isn't it? And we want to promote this honesty even in terms of in overall all healthcare fraternity. This is what we are trying to encourage. Doctors also, people who are watching also, we should do ethical practice, isn't it? That's very important, and that will help the mankind and the community, because today, as you see, Kausharai, a lot of people are dying, unfortunately, in front of our eyes. You will see that as a doctor, when I know now, it is all reversible. Everything is reversible. I have some friends who been unfortunately been had to undergo bypass at the same time, because they were put on insulin and so much of medications they were on for almost 20 years. So it's very sad to see this, though it's so easy to reverse, just all you have to do is change your lifestyle. And definitely, because we are here to help and guide. If you're on a medication, anybody's on the medication, they require a little more support and more guidance there. This is what we provide at our platform, a completely evidence-based guidance, what we provide. And this is how we bring people to revert stage, to reversing them and bringing them back to their default state of their metabolic health. So thank you everyone for watching us, and keep following us, so that we keep on coming up with such kind of more webinars in future.